Hi, welcome to the section of cardiology. This is Dr. Jaitly here. In this particular vignette, I'll be talking to you about what are heart palpitations. That's a very common symptom normally experienced by most of us one time or the other in our lives. It could be after a few cups of coffee, but that's something which is relatively benign, and hopefully in the next several hours after you drink a lot of water, the palpitations will disappear. But in general, it normally is precipitated by a very severe anxiety, stimulants, if some individual is taking stimulants over the counter, alcohol, and illicit drugs, they will produce heart palpitations. And those are very significant because invariably they end up in arrhythmias. Arrhythmias are obviously irregular heartbeats, and one can assess them like I'll be talking to you about by an EKG or a Holter examination. They could also manifest, the heart palpitations could also manifest as a heart condition involving arrhythmias per se, heart failure, or even a heart attack. So in other words, the rest of the conditions where the heart is involved, or a valvular condition like a mitral valve prolapse here, like shown on my right diagrammatic schematic here, where the mitral valve tends to bulge into the left atrium and the left ventricle contracts. That is a mitral valve prolapse condition where the valve is extremely thin or redundant, and the texture of the valve is different than the normal valves people have, and as a result the valve tends to bulge into the left atrium. And that results into palpitations, very commonly skip beats, flutter-like sensations, or even heart pounding, whether fast or strong, can be the presenting symptom of the patient. So palpitations can manifest in either of those ways: skip beats, pounding of the heart fast and strong, or a flutter-like sensation within the chest. So obviously palpitations should be taken very seriously. You try to remove all these precipitating factors, chiefly alcohol and illicit drug abuse, because that will only make things worse, and sometimes even life-threatening arrhythmias can ensue. Underlying conditions of the heart must be recognized as well, simultaneously, whether you're dealing with a heart failure in addition, or there is some heart attack at the time going on, or there is a valvular condition like a mitral valve prolapse existing, or there are arrhythmias already present to begin with. So normally it is assessed by an EKG and then immediately followed by a 24-hour Holter if necessary. So an EKG is done at the doctor's office, and then a 24-hour Holter, which is like a small scan attached to you, and with a couple of leads in your chest, and you go home with it, you sleep with it. Next day you bring it back to the doctor and return it, so the doctor can actually look at your normal beats, look at any episodes of fast beats, any episodes of slow beats like here I've shown, or any episodes of irregular beats like I've shown here. So all of these beats are tabulated and analyzed, and then the doctor will define a treatment for you at the end of the Holter examination is read. So in a nutshell, now you know what heart palpitations are. In general, they are to be taken seriously, and specifically so if they are persistent, and must discuss that with your physician, because underlying arrhythmias specifically could be life-threatening at times, and patients can sometimes even pass out or have dizziness, lightheadedness, severe sweating-like symptoms. Patients may feel chest pain, pressure, tightness. All are the manifestations also accompanying palpitations. So it is an important symptom, and very common symptom in a lot of cardiology clinics where the patients are presenting to see the doctors. So feel free and discuss with your friends more, and join us again for our next video presentations. Thanks so much. Take care now.